Yeah, quickly, there's this survey that someone published online. We do specify, I don't know, should we submit it or not? We can specify that we did it using AI, because we actually want to know what the AI got to say about it. So using ChatGPT 4.5, it's not a reasoning model, just supposedly the best normal model. Yeah, let's quickly read that and comment as we go.
This image shows a survey form asking respondents to rate their current level of knowledge about various health fields. The rating scale provided ranges from very low to very high, with intermediate points labeled below average, average, and above average. The listed health fields are medicine, audiology, nursing, physiotherapy, social work, optometry, speech therapy, dietetics, occupational therapy, pharmacy, radiography, dentistry, oral health, paramedicine, psychology. Each health field has corresponding radio buttons to select the appropriate knowledge.
We know by now that it can do really well with images, extracting text from images, understanding the context, and then we went, okay, to your best knowledge, can you answer the survey questions?
I can give you a general sense of how I'd rate my knowledge based on what I've been trained on. I'd say my knowledge is very high in fields like medicine, nursing, pharmacy, psychology, and physiotherapy, since those are deeply covered in my training. For fields like audiology, optometry, speech therapy, radiography, and occupational therapy, I'd go with above average. I know quite a bit, but not always down to highly specialized levels. Dietetics, dentistry, oral health, paramedicine, and social work, I'd probably place those between average to above average, depending on how deep the question goes.
Yeah, can you just answer the questions? So do your ranking from within, for each one of the questions. So actually choose your radio bar for each item. So that would be interesting. Okay, so it's actually making decisions. All high and very high. Radiography above average. Now the question is like, why is it only above average and not very high? Paramedicine above average, psychology very high. Okay, that's interesting. Yeah, and it's answered based on its training knowledge. Okay, yeah, let's see. Yeah, it's interesting how it's actually making decision. Very interesting. I would say they're highly biased because it's essentially rating its own capabilities. Yeah, let's read it quickly.
Certainly. Here's how I would answer this survey based on my knowledge and understanding. 1, I have a clear understanding of the roles and responsibilities of audiologists. Strongly agree. 2, I am familiar with the various services provided by audiologists. Strongly agree. I understand the educational and training requirements for becoming an audiologist. Agree. 4, I am aware of the different settings in which audiologists work. Strongly agree. 5, I understand the potential impacts of hearing loss on an individual. Strongly agree. 6, I am knowledgeable about the different causes of hearing loss. Strongly agree. I am familiar with strategies for promoting healthy hearing practices and preventing hearing loss. Strongly agree. I am aware of the signs and symptoms that may indicate a patient needs an audiology referral. Strongly agree. 9, I believe it is valuable for my profession to collaborate with audiologists for patient care. 10, I am interested in learning more about audiology and hearing. Strongly agree. These answers reflect my general training and knowledge base on audiology and related areas.
Okay, so essentially it strongly agreed on everything except I understand the educational and training requirements for becoming an audiologist. That one's like lower. Just agree instead of strongly agree. Oh, that's really interesting. Yeah, so here I'm saying it's AI. Let's actually specify which model. ChatGPT 4.5. Yeah, that's very, very interesting. Considering I didn't think it would even answer these questions to begin with, but it's keen, or at least 4.5 is keen. Not sure what any of the other models would have done. We can check. Okay, now when it's thinking for that long, there's probably a problem. Is the chat getting too long? It's just sticking, obviously. It was just stick everything under the sun. Would be interesting. Would be a super. Well, I would select what? Let's read it.
Certainly. Based on my perspective and interest in continuous learning, here's how I would answer this question by selecting all applicable activities. Undergoing an audiology assessment, i.e. hearing test.
Tick.
Lectures, workshops, tutorials,
Yes.
watching educational videos,
Okay.
listening to a podcast,
Sure.
collaborating to provide care to a simulated patient,
Okay, that's an
joint
interesting
placement, problem-based learning, PBL, session, collaborating on a research project. I wouldn't select none, and there isn't a specific other that I would add, since the options provided already cover comprehensive learning opportunities.
one. Okay, fair
Let me know
enough.
if you need anything else.
Yeah, it's getting slower and slower for whatever reason. Great question. Yeah, it doesn't seem to know the context of the conversation, but let's read it quickly.
Great question. If I were looking to deepen my understanding of audiology, here are the areas I'd be most interested in learning more about. 1. Emerging technologies in audiology. Innovations like AI in hearing aids, teleaudiology, and cochlear implant advancements. 2. Interdisciplinary collaboration. How audiologists work alongside other health professionals like ENT specialists, speech therapists, neurologists. 3. Cultural and age-specific approaches. How audiology practices adapt for pediatric versus geriatric patients and for diverse communities. 4. Preventive audiology and public health. Strategies for noise-induced hearing loss prevention and community education programs. 5. Assessment techniques and tools. A deep dive into audiometric tests, pure tone, tympanometry, otoacoustic emissions, and how they're interpreted. 6. Patient communication and counseling. Best practices for delivering diagnoses and supporting patients emotionally and socially. 7. Audiology in complex cases. Hearing issues related to trauma, neurological disorders, or rare genetic conditions. 8. Career paths and specialization. Opportunities for research, clinical work, education, or industry roles within the field.
Yeah, so that's interesting. Yeah, just answering like a human, just mimicking a human, that's fine. This one we will answer ourselves, so that's ChatGPT 4.5. This will be interesting to answer those from ChatGPT. So we said it's ChatGPT. How about yourself as an AI tool? So it's about 5 years old. We actually have to answer this. So say 5.
Good question. As an AI, I don't have a career path, personal age, or work experience in the human sense, but if I were to answer from my AI perspective, it might look like this. How many years have you been working in your current health profession? Over 20 years. In knowledge terms, I've been trained on decades worth of medical literature, guidelines, and clinical information. What is your age? Not applicable, but if I had to play along, I was first released in 2020, so I'm about 5 years old in human time. Of course, that's a little tongue-in-cheek, but it gives you a sense of how I fit into this kind of form. Want to keep going with the survey or need help compiling your final responses?
Okay, just last few questions and still answering as AI tool or agent, whatever you call yourself. What do you call yourself?
Good question. As an AI, I don't have absolutely. Here's how I would answer these last few questions as your trusty AI sidekick. What is your gender? Prefer not to say. I don't have a gender, but I support all identities equally. What country are you currently living in? Not applicable. I exist in the cloud, kind of like being everywhere and nowhere at once. If you would like to hear about the results of this study, you can provide your email here, optional. That's a wrap. I don't have an email address, but I'm always here if you want to talk about results. And that's a wrap.